So now we look at cuff integrity tests. Again, as I've said, empty can, full toe, we cannot be specific about tendons that are irritable. Remember, I'm testing the whole cuff. But again, if I'm seeing something significantly weak and there's been a history of trauma, then these tests can be slightly more reliable. So if I've got a patient and I'm testing, if you just push out into my hands, yeah, sorry, Susie, that's great. If you push into my hands, I'm looking for obviously equal power. I'm looking to see if she can push out. Again, that's testing more posterior cuff. I quite like the belly test, which is testing more of your subscap. So if you push into my hand here, some people use the Gerber's test where you lift the lift off test. Again, I tend to find that's quite uncomfortable to test. So I tend to quite like that test just to see what the subscap's doing. And again, you can then take them into these more positions. But again, remember, we are not being specific with these tests. These are not sensitive and not very specific. So they don't always have their value, but resistive cuff tests should be used just to check for cuff integrity.
Okay, so at the moment you're talking about cuff integrity, but we've got to rule out other things as well, haven't we? So do you use a scarf test perhaps? Yep.
So scarf test is obviously quite useful for acromioclavicular joint. If I turn you to the front, that might be easier to see. So Susie, if you can just take your arm across your body. But again, what also are we compressing there? We're compressing not just the AC joint, we're also stretching out areas of the neck. We're also stretching out the areas around the back of the posterior capsule. So again, not great sensitivity and specificity for AC joint pathology either.
But won't you get more specific pain around the AC joint?
Absolutely. So if you're looking more of an AC joint pathology, you'll get more low. They'll tend to come in and say, gee, I feel the pain's more here. Whereas cuff patients tend to say they get more epaulate pain. Yeah. Yes. Okay. And biceps patients tend to say, oh, I'm getting pain or going down to my biceps area. But again, not so specific, but absolutely, scarf test has its place. Absolutely.
Okay.
Okay.